Hi, I'm Esther. We're presenting our topic on mental illness. Main topic will be depression. I'll be presenting the initial piece. The other piece will be presented by my other team member, Lindsay and Lynette. Depression often begins in early age, 20s and 30s. Depression is a common mental disorder that causes people to experience moods of highs and lows. It's not just the blues. Depression can stay, you can feel depressed for a period of up to 2 weeks with diagnosis of 4 or more specific symptoms to be considered depressed. Feeling of sadness, weight gain, weight loss, agitation, suicidal thoughts, the lack of desire to work, to study, to enjoy life. The pathophysiology of depression. Depression is clinically different from the blues, as I said before, and involves chemical changes within the brain. Okay, neurotransmitters, especially noradrenaline and serotonin, are believed to be the key in control of mood and emotional behaviors. There are different types of depression. Depression such as psychotic depression, persistent depressive depression, bipolar depression. Depending on which one you're experiencing, persistent depression is depression that occurs every day and lasts for more than 2 years. Psychotic depression is a different form of psychosis where the patient experiences hallucinations or psychotic episodes. Postpartum depression comes from depression after a mom delivers or gives birth to a baby due to physical changes, sometimes new responsibilities. Life itself can cause postpartum depression. Another one would be seasonal affective disorder, where a patient experiences the depressive episodes during the winter months and then they're back to normal again during the other seasons of the year. Major depression is the person having difficulty with sleeping, working, studying, and just in general normal life issues. In our presentation, we discussed a patient, Mrs. Bean, who came into the hospital. In my portion of the presentation, I'll be discussing stage 2. Stage 2 is based on Mrs. Bean behavior, what will be the next step to ensure the patient is safe and free from harm. Because Mrs. Bean expressed the idea of wanting to kill herself, we have to enact safety precaution for Mrs. Bean. Safety precaution means the patient will be Baker acted and she will now have a sitter at the bedside. Question number 2. Would the patient change in behavior? Which specialty needs to be consulted for further evaluation of the patient immediately? The specialty will be psychiatrist. Having a psychiatrist on board will be the first step to getting the appropriate treatment for depression or any other emotional problem the patient may be experiencing. During the evaluation, the psychiatrist will obtain important information for patient assessment, information such as medical history, current mental status, medications that they may have been taken, and other online factors to determine whether or not the patient is indeed experiencing a depressive illness. With Mrs. Bean, after the psychiatrist assessment, it was determined that the Baker Act can be lifted. The patient did remain hospitalized for further evaluation and care. The other pieces of the presentation will be presented by the other team members. Thank you.